The United States has faced a new health challenge since March 2024, an outbreak of H151 avian influenza, commonly known as bird flu. This virus, initially detected in poultry, quickly spread to other animals. Dairy cows became infected, raising concerns about potential transmission through unpasteurized milk. By December 2024, the virus had jumped to humans, resulting in 61 confirmed cases across the country. The emergence of H151 has put health officials on high alert. The virus's ability to infect multiple species, including humans, underscores its potential for widespread transmission. While the Centers for Disease Control and Prevention, or CDC, maintains that the overall risk to the general public remains low, the situation is being closely monitored. The spread of H151 serves as a stark reminder of the interconnectedness of human, animal, and environmental health. As the virus continues to circulate, it poses a significant threat to public health and the agricultural industry. The outbreak highlights the need for robust surveillance systems, preventative measures, and a coordinated response to effectively manage and mitigate the impact of this emerging infectious disease. The early stages of the outbreak primarily affected commercial poultry farms, but cases soon emerged in backyard flocks, indicating a wider reach of the virus. The situation calls for increased biosecurity measures, both on a large scale and at the individual level, to prevent further spread and protect both human and animal health. The fight against H151 took a concerning turn on December 18, 2024, when the CDC confirmed the first severe case in the United States. A patient in Louisiana, over 65 years old and suffering from underlying health conditions, was hospitalized with severe respiratory illness. This marked a significant escalation in the severity of H151's impact on humans. The Louisiana case was identified as the D1 genotype, a strain previously detected in wild birds, poultry, and human cases in Washington State and British Columbia, Canada. This genotype differs from the B3.13 genotype, which has been linked to dairy cows, sporadic human cases in various states, and some poultry outbreaks in the US. The emergence of a severe case, while concerning, did not come as a complete surprise to health experts. Avian influenza viruses are known for their unpredictable nature and their potential to mutate. The D1 genotype's ability to cause severe illness highlights the importance of ongoing surveillance and research to better understand the virus's evolution and its potential impact on human health. The Louisiana case served as a stark reminder that while most H151 infections in humans had been mild up to that point, the virus had the potential to cause serious illness, particularly in vulnerable populations. The case underscored the need for continued vigilance, public health interventions, and individual protective measures to mitigate the risk of infection and severe outcomes. The investigation into the Louisiana case revealed a crucial detail. The patient had been in contact with sick and dead birds in backyard flocks. This finding highlighted the role of backyard poultry in the spread of H151, a factor not previously considered a major driver of transmission in the US backyard flocks. Often smaller and less biosecure than commercial operations, can become breeding grounds for avian influenza. These flocks often have closer contact with wild birds, which can carry and spread the virus. The Louisiana case emphasized the importance of biosecurity measures even in small-scale poultry settings to prevent the virus from spilling over from birds to humans. The CDC issued guidelines for backyard flock owners, emphasizing the need for strict hygiene practices, limited contact between poultry and wild birds, and regular monitoring for signs of illness in their flocks. The Louisiana case served as a wake-up call, prompting many backyard poultry enthusiasts to re-evaluate their practices and implement stricter biosecurity measures to protect themselves and their communities. The case also highlighted the need for increased awareness among backyard flock owners about the risks associated with avian influenza. Educational campaigns and outreach programs targeting these communities became crucial in disseminating information about the virus, prevention strategies, and the importance of early reporting of suspected cases. Section 4, from mild to severe. Understanding the shift in H151's impact. Before the Louisiana case, H151 infections in humans had been characterized by mild symptoms, primarily conjunctivitis, also known as pink eye, and mild upper respiratory issues. None of these cases required hospitalization, leading to a perception of the virus as relatively low risk for humans. However, the severe case in Louisiana challenged this understanding. The shift from mild to severe cases raised questions about what factors might be driving this change. One possibility was viral mutation. Avian influenza viruses are known for their ability to mutate rapidly, potentially leading to changes in their ability to infect different species and cause more severe illness. Another factor could be the health status of the individuals infected. The Louisiana patient, being older and having underlying health conditions, might have been more susceptible to severe illness from H151. The emergence of a severe case emphasized the need for ongoing surveillance to monitor the virus's evolution and its impact on human health. It also highlighted the importance of developing effective vaccines and antiviral treatments for H151, especially for those at higher risk of severe illness. Section 5. Navigating the risks, the CDC's assessment and recommendations. Despite the emergence of a severe case, the CDC continued to assess the overall risk to the public from H151 as low. This assessment was based on several factors, including the limited number of human cases, the absence of sustained human-to-human transmission, and the effectiveness of control measures implemented in affected areas. The CDC emphasized that the situation was evolving and that the risk assessment could change as new information became available. They stressed the importance of staying informed about the outbreak and following recommended precautions, especially for individuals who work with or in close contact with birds. To mitigate the risk of H151 infection, the CDC recommended several preventative measures. Avoid contact with sick or dead birds. If contact is unavoidable, wear appropriate personal protective equipment such as gloves and a mask. Practice good hand hygiene. Wash hands thoroughly with soap and water, especially after handling birds or poultry products. Cook poultry and eggs thoroughly. Heat kills the avian influenza virus, so ensure all poultry products are cooked to an internal temperature of 165 degrees Fahrenheit or 74 degrees Celsius. Stay informed. Follow updates and guidance from the CDC and other reputable health organizations. The CDC's message was clear. While the overall risk to the public remained low, vigilance and preparedness were crucial in managing and mitigating the impact of H151. By staying informed, following recommended precautions, and reporting any suspected cases promptly, individuals could play a vital role in protecting themselves and their communities from this emerging infectious disease.